Welcome to Lupus with Linda, managing lupus 2 minutes at a time. Lupus is chronic. A chronic disease is one that lasts a long time, often for life. When we think about illness, most of us think about acute illness. Strep throat, a broken bone, or appendicitis are acute illnesses. Acute illnesses have a clear onset. They're pretty easy to diagnose. Tried and true treatments usually result in recovery or cure. Chronic illnesses have symptoms that come and go. Figuring out the exact time of onset is nearly impossible in most cases. Chronic illnesses are not easy to diagnose. In the case of lupus, patients may search for a diagnosis for years. They see multiple doctors along the way. Often, getting to a diagnosis is a process of elimination. Many chronic illnesses share the same symptoms. And with lupus, there is no definitive test. To complicate matters more, most people have more than one chronic condition, especially when it comes to autoimmunity. When we finally have a diagnosis and a name for what's wrong, we feel relieved. Now that I know what I have, let's get going and make me better. The relief at being able to name your malady is followed in short order by frustration. Finding the right treatment plan is often a process of trial and error. In acute illness, the doctor prescribes the treatment, you follow orders, and you probably get better. If a bone is poking out of your skin, or if you have a raging fever from infection, you are not likely to suggest that alternative treatment is the way to go. Treatment is not negotiable. In chronic illness, the doctor prescribes treatment, you follow orders, but you might not get better. However, the treatment may prevent damage or slow the progress of the disease. Don't write a treatment off because it's not a cure. But there is another important difference. In chronic illness, you and the doctor are partners in your care. You live with and manage your condition 24/7. You only see the doctor every few months. Forging a partnership with your doctor might be a challenge. Do it anyway and always be honest. Your doctor chose this profession out of a desire to help and heal. A word of caution. Please don't Google like crazy and bring a ream of printouts to your appointments. Your doctor has heard it all before. Ask questions, but don't take it on yourself to educate your rheumatologist. Remember, it takes about 10 years to become a rheumatologist. Yours might just know a thing or two.